Indian education system as whole follows certain prototype. So do you think any changes or reforms are needed that can improve the quality of education and also reduce the stress on the students? How do you think we can change the system?
Changes I'd like to see in the emergency department, especially medical education wise, is I think we really need to integrate a lot more simulation based education into emergency medicine because that is the future, right? So, the skill based training, your simulation based training, they really improve patient safety and the level of understanding of a student, the level of retention of medical science is much higher because there is something called a Yokes-Dodson curve, right? This particular metric, it demonstrated that when you put the students in a certain amount of pressure, when you put them under a certain amount of stress, that's when they learn to their maximum capability, right? So it's not about just teaching a class, or it's not about putting them at the patient side and then expecting them to learn. That really doesn't work. So you create an environment which simulates the stress environment in an ER, and you let them practice and learn. That really enhances retention, and that's pretty evident from science. So yeah, medical education is pretty serious stuff. Most people don't understand this. Medical education itself is a separate specialty of medicine. That's how I put it. Right? Most people don't realize this, and this is something I've come to realize recently, and I'm starting to read about it. I'm starting to delve into it more, and I find that it's a fascinating and difficult subject. And it would be great if there are structured training programs for our teachers. It would be great if our teachers don't teach at their own whims and fancies, right? It would be great if there is a way of training our teachers to teach better, and that is what is essential to ED management. I'm not saying my teachers are bad, but I'm just saying that we would be much better off with better teachers, right? A better teacher does not mean someone who has better knowledge. The knowledge aspect is already there. We have the knowledge aspect of it, but it's about delivery that is lacking to some extent, and yeah, that could really help the emergency medicine education system. And needless to say, there's a lot of controversy about recognized, unrecognized ET degrees. Irrespective of all that, we really do need teachers who are trained to teach.
That's an interesting strategy. Tell us about the sim wars that you've been holding continuously. What was your inspiration like? How did you get inspired? And we see there's no stopping now.
Sim wars, right? So that's the question. What is sim wars? What exactly are we doing in this sim wars thing, right? So sim war is basically set up by EMRA, right? The Emergency Medicine Research Association of USA. They started the whole concept of simulation wars, wherein they give simulation scenarios to different teams and they compete against each other. Sim wars has happened in India before. It happened in MCon 2018. I was part of a competing team, and our team got destroyed. Our team got demolished in that sim war. It was embarrassing as hell. My HOD looked at me and said, yeah, so it was the most disappointing face I've seen from him ever. So that's when I thought, you know what, I'm not going to do Simwar anymore. I'm going to conduct Simwars. I'm going to teach Simwars. So simulation happened, and at this year's MCon 2021 at Bangalore, I'm the lead faculty for the Sim Leagues. We've changed the name a little bit. Last year Simwar as well, Sim Leagues as well, I was a lead faculty, and this year we're doing it on a completely virtual platform. So Sim League is basically a competition. It really puts your team skills to a test because as an independent emergency physician, you might know everything, but when you work together as a team, that really brings out system complications, system problems. It will tell you what processes are lacking, how your communications are failing, and all those things. So Symbios is very, very exciting. Even though you're sitting in front of a computer, you feel that stress. I see students sweating in front of the computer because we give them such complicated scenarios. So I see you at Sim Leagues this year at M1 2021. It'll be exciting.
Let's talk about the super intern program. What was your motivation? I see you have created waves everywhere. So conducting it virtually seems to be a different high altogether. Tell us.
I have this program going on called the Superintendent Project. Now, I started to firmly believe in the model of blended learning, right? And I think that online learning can also be a huge tool. Though the super intern is dedicated to MBS interns who obviously lack hands-on training, and because they're usually left to the mercy of postgraduates, and the concerns are busy. They're in a government hospital. They really can't learn much, but they're always doing, doing, doing. So this is an online-only platform wherein I dedicated classes to 90 minutes a day, 3 times a week, so people can adjust their shifts and then come to the class. And I use virtual simulation softwares to give them actual patient scenarios. where they can we can discuss online together as a team and decide what to do. And the feedback has been great so far. It really works. So it's all about using virtual tools. It's not just talking one on one, long lectures. It doesn't really make sense. So it's trying to innovate using online tools, simulation software, etc. The super intern project has benefited quite a few interns, and I'm doing the second edition in a few days. The first edition saw about 20-30 interns, and yeah, the feedback has been great. The real inspiration was that when I was an intern, even though I was like super enthusiastic, I had the resources to learn, I had the patience with me to do. Yeah, I didn't really do much because nobody was there to guide me. My PGs did guide me. I'm very thankful to the PGs who did. But yeah, even they're learning. They're not perfect teachers, right? Even they're learning. And my consultants and my doctors and my professors and all are adequately busy at the bedside. So you really can't learn to hope much, hope to learn much. Sorry, hope to learn much. But yeah, the inspiration was that what I lacked in my internship. And I feel personally as a doctor now, as an emergency physician now, my internship taught me who I am. It showed me that I'm a punctual guy. It showed me that I'm a hardworking guy. It showed me that I'd go out of my way to help out a fellow colleague when they're struggling. So your internship for an undergrad is absolutely essential. It really teaches you what kind of doctor you want to become. If you are that kind of intern who's putting internship aside and preparing for NEET, you are fooling yourself. I'm sorry, but you're really missing out on the most important 1 year of your life.
To take simulation as a whole-time career, what are the resources they have to refer to, and where can they get better exposure?
Right. For people who want to take simulation as a full-time thing, it it takes more dedication than emergency medicine. Trust me, because it's a completely new, different field. Right. You're not going to do simulation on a daily basis. You have to design curriculums. You have to market. You have to sell your product, and you have to be good at it. So, like I said, it's not for everybody. Like it's not just like emergency medicine. You have to seek it out. It's not a choice. So, first of all, you have to find a teaching pedagogy, right? You have to find something you're good at. You have to find how you're going to enchant your class. That comes first, and then you think about getting into it as a career. It will come as you learn through it, but it requires full-time dedication. Teaching is not a part-time job. Let me be very clear about that. I realize that now because I'm into full-time teaching. It's not a part-time job. Okay, so my simulation is called GSS Smart Lab, simulation modules for advanced research and training. It's a lab basically. It's a standalone unit, even though it's part of medical college. Most of it functions on its own. I head the department here, and I have administrative roles wherein I decide who comes to the simulation lab, which postgraduate comes, and everything. So as it's a medical college, it has a medical college, undergrads and postgrads. It has a super specialty college as well. We have a dental college, we have a nursing college, we have a physiotherapy college, we have a paramedical college. So my simulation center, it caters to all these people. That's about 2,500 students per year. So that's a big number. And I have a team of 4 people working with me who make sure that all this happens smoothly. When it comes to academia, though, when it comes to simulation academia, I'm fully in charge. I'm the one who delivers all the simulation aspects of it. The faculty are very, very helpful. I have active faculty from Department of Anesthesia and Department of Obstetrics as well, who take part very actively in simulation. The nursing college is very, very supportive. So we have everybody involved in it. But yeah, the entire administration happens from the simulation lab. That's what makes it very unique. It's standalone, right? It's not administered by one particular medical department. The simulation lab is completely different, separate. So this lab is pretty extensive. It's almost a 40 crore investment, and that is huge for India. It's one of the most heavily invested simulation centers in the country right now. I can say that with pride and honor. And my boss is heavily invested in simulation. My chairman, Dr. Gani Bhaskar Rao, he has a special interest in simulation, and his son, our director, is also a PhD in simulation. So they have a personal investment in this. They know what they're doing. So that's why they are unhesitant to invest in simulation. Now, the simulation aspect of it has multiple parts to it. When you talk about simulation, there's something called low fidelity simulation. There's something called mid fidelity simulation, high fidelity simulation. All this means that how close to real life is it? If it's high fidelity, it means it's very close to real life, right? Like we have a mannequin called HPS, Human Patient Simulator, right? This particular mannequin can mimic everything of a human, right? This guy can talk. This guy breathes like a human being. He has actual oxygen carbon dioxide gas exchange. You can connect him to a ventilator and anesthesia circuit, and he detects the gases and responds accordingly. You can give him specific injections. He will detect which injection you're giving him, and he has a physiological response to it. Like you give atropine, his heart rate will automatically increase. The mannequin knows so much of human physiology. You can feel the peripheral pulses, you can feel the central pulses, you can do CPR, it'll measure the CPR metrics. You can intubate, you can elicit difficult airway. I can make his tongue swell up, I can make his larynx go into spasm, I can make him cry, I can make him bleed. You can put an intercostal drain and you'll actually see blood coming out. You can put a voice catheter, it'll actually be urine coming out. You can do diagnostic peritoneal lavage. You can do pericardial synthesis. The list is endless. This is high fidelity simulator, and we have that guy in our simulation center. We use that for simulation. We have a birthing simulator, Lucina. She will deliver a baby just like a human being does, and not just in normal labor, but also in abnormal labor. You can elicit obstructed labor, dystocia, etc. I can elicit grade 3 postpartum hemorrhage with actual bleeding. Actual bleeding, as in not literally actual bleeding. You get artificial blood, which will go into the patient's cavity. And the baby also comes out crying and kicking. So you can check the APGAR score, which is even more brilliant. Now, this system is integrated with Microsoft HoloLens, which means it is mixed reality. And this is one of the only mixed reality devices available in India. You wear the HoloLens and you can see the baby moving inside the mannequin. So you see the mannequin as well, and you see the virtual reality part of it, wherein the baby is actually moving and twisting and coming out, and descending into the uterine cavity. And that takes it to another level of interest of the student. The student is really engaged now. He wants to see this and he's fascinated by it. And even I was fascinated when I first saw it. So yeah, we have that kind of simulators. Then we have skill lab, an extensive skill lab where you have skill trainers, basically small IV arms, groin where you insert a pulley catheter. You can place an intercostal drain mannequin. You have a central line mannequin. You have airway for adult and pediatric mannequins. You have CPR mannequins with quality, which give you feedback of quality. We are an AHA certified training center where we do BLS, ACLS, and PALS training. We have a virtual reality dissection table wherein a cadaver shows up on this large touch screen, right? And then you can dissect virtually, just like a real patient. And it's much more intuitive than a real patient because the cadaver has infinite possibilities, right? You can pick out the brachial plexus and name all the nerves in it. You can pick out the entire cardiovascular system and name all the veins in it. You can in spatial arrangement you can 3D rotate it, right? You can zoom in, you can zoom out, you can cut through a particular section to teach regional anesthesia. We in fact published a recent paper on regional anesthesia on how to use virtual reality dissection for teaching regional anesthesia. So we have that table here. Then we have mentor trainers, which are made by this company called Surgical Science. And these mentor trainers, they replicate the entire procedure of, let's say, a surgery, a laparoscopy surgery, or robotic surgery, angiography, interventional radiology procedures, endoscopy, bronchoscopy, ultrasound, and ultrasound interventions. So we have a specific mannequin or a mentor for each of these procedures. And we are the only center which has all of these under one roof. So we can train all the way up to super specialty. It's the possibilities are endless. So it's a sight to behold. You really have to come here to experience it. And I had no idea when I was working in a simulation center in Hyderabad that this center even exists, but it does, and I think people should make use of it. So it's pretty amazing.
GSL Smart Lab Simulation Modules for Advanced Research and Training Laboratory. A world-class medical and surgical training platform aims at remodeling the approach towards patient care in India. An interdisciplinary, state-of-the-art virtual medical setup that allows medical and nursing students, physical therapy students, community EMTs and social activists to practice clinical procedures in a safe learning environment.
In recent trends, it has been noticed that students are lacking the practical skills required for their practice.
GSL Smart Lab is founded on the same core principles of GSL Educational Society and providing world-class facilities.
A comprehensive solution for the flexible bronchoscopy training needs of pulmonary and critical care physicians, anesthesiologists, and interventional pulmonologists, as well as for the training of gastrointestinal upper and lower endoscopic procedures. For the ever-growing utilization of ultrasound in medicine, especially at point-of-care setting. Skill Sports Lab. CPR Training Mannequins provides realistic adult CPR and infant CPR training and other core skills for BLS training. Advanced Skill Trainer Mannequin focuses on the core skills of ACLS training. Operated with a SIM-pad, it provides comprehensive instructor-to-student debriefing and documentation of key events along with instructions on first aid and extrication.